Hi and good day, everyone. Welcome to another episode of the series TBYP, or Tips to Boost Your Knowledge in Pharmacology for medical students and other students of medical background. I'm Dr. Marwan here with you again. Tip number 6 about good prescription writing. We all know that the ultimate goal of any of you as medical students after you graduate and during your professional life after this is to be able to write a prescription, which is actually uh, an art. An art to write a prescription and become a good prescription writer. And among the tips for being a good prescription writer is uh, that the person who writes a prescription, the physician who writes a prescription, he should know when to prescribe the drug. Second important issue or important point is to know what to prescribe in the prescription and how much of that drug is to prescribe and for how long should the prescription or the treatment continue for that specific patient. So we have a few examples and we want to know your participation later in the forum whether these examples are appropriate for being a good prescription writer or inappropriate for having a bad prescription writing attitude. So the person who prescribes should only prescribe when necessary, having carefully assessed the balance of benefits and harm. For example, the example here is having antibacterial uh, drug for treatment of viral infection. So later on in the forum, we will have to discuss about the inappropriateness of that and the reason behind it. A good prescription writer should choose the correct medicine that is appropriate for the disease and the patient condition. For example, uh, a prescriber or a physician who prescribes a broad spectrum antibacterial agent for an isolated staphylococcal infection. Is it appropriate? The answer is no. Why is it inappropriate? That's what you're going to have to share your ideas about the reason and in the forum. Uh, a prescriber who chooses is a good prescriber when he chooses the dose regimen that is appropriate for the disease and the patient also. For example, 300 milligram per day of aspirin for prophylaxis or for prevention of ischemic heart disease. Is it appropriate? The answer is no. And later I want to hear from you in the forum about the reasons and the causes. A prescriber who continues therapy for an appropriate time is a good prescriber, and he can alter the doses whenever it is necessary. For example, if a physician prescribes anti-tuberculous treatment for the duration of 6 months. Is it appropriate? The answer is yes. Why is it appropriate? I will have to hear from you during the forum. So, in brief, uh, the good prescriber or good prescription writer is the one who knows when to prescribe, when to write the prescription, and what to prescribe about the drug, exactly what is the drug, and how much of that drug means the dose, and for how long means the duration of the treatment to keep the patient for. With that, we have ended this tip number 6. Thank you very much and see you again. I'm Dr. Marwan with another tip to boost your pharmacology TBYP. Assalamu alaikum.